Welcome to the Community Brew Podcast, Commerce and Conversations, brought to you by the carefree Cave Creek Chamber of Commerce, where local business meets local flavor in the heart of the beautiful Desert Foothills region. We're serving up fresh insights, inspiring stories from business owners, experts, and community leaders shaping our vibrant community, including simple strategies to help you grow your business faster. And now, here's your host, President and CEO of the Carefree Cave Creek Chamber of Commerce, Steve Feld.
Well, welcome to the Community Brew. I'm Steve Feld with the Chamber, and with me today is another great guest, so unique. You're going to love her, Eric Mond from DMD Dental.
Good
Welcome.
morning. Good morning. Thanks for having me.
Okay. Dumond, New Orleans.
New Orleans. Unfortunately, I am not the person who owns the coffee. But I actually went to school in New Orleans. I went to Tulane. So definitely have been to Cafe du Monde.
Just a few times.
Just a few times. I mean, a beignet is a beignet.
And they know how to make a beignet.
And chicory. I used to actually import the chicory coffee when I moved here because I was missing a little bit of home.
I don't blame you.
The beignets don't travel as well.
No, they have to be hot and fresh. For those of you who haven't had that beignet, oh my gosh, you're missing the fluffy donut.
Yeah.
And powdered sugar.
Yep.
Well, I got to start off because your dentistry is so different than what we all think of as a normal dentist, right? And you do something so unique. But before we get into that, you got to let us know, how did you get into dentistry?
So my father and grandfather are both dentists. And my father told me, I started off in finance. And he told me, you absolutely have to become a dentist about 10 years into my finance career. And I was like, no, Dad, it's too long. I've waited too long. I need to do it. I can't. And he was like, nope, it's the way your brain works. It's what you're interested in. You need to be part of medicine. You need to be part of healthcare. And so I waited another 10 years till I was really much older than I wanted to start. And I was like, Dad, you're right. Like always, you're right. And so I went back.
Dang parents, huh?
So right. Always right. Always follow your dad's advice.
Yeah. Somehow they sometimes know what's better for us than our.
Yeah, I don't know. It's not like they spent their entire time, creating you.
Exactly. Crazy you. Well, great. Now let's get in okay, you're dentist. I mean, we just had your ribbon cutting recently. And tell us a little bit more, because I was kind of shocked. I was amazed, actually, how you were so different than your normal, what we all are thinking as a dentist.
Yeah. Well, I try to make, okay, there's actually a study that said people would rather die than go to the dentist, which I really don't believe any of you would rather die than go to the dentist. But that illustrates how people feel about a dentist. So I have created a space where I feel like people are really comfortable. It doesn't feel like a dental office. So I took a lot of time and intent in the way that the environment was presented. And part of that was because I don't want to be viewed like your normal dentist, because I'm not looking for treatment. I'm not looking for kind of fixing what's broken. I'm looking at your oral and systemic well-being and how can I improve how long you live well and how long your life is at the character and the activity that you desire. People live a long time now, but what is that life? What is that quality? And I want to focus on improving your quality of life so you can live the life that you want. And most people wouldn't think that has anything to do with dentistry, but the oral systemic connection is well established. There's mounds and mounds of literature about the fact that what's happening in your mouth is happening in your body. The pathogens that create a lot of the problems in your mouth are creating the problems in your cardiovascular system. They're precursors to dementia and Alzheimer's. They are contributing to glycemic control issues and cancers within the body, and also pregnancy issues. So the information is there, and I'm just trying to get it out to the community to think of us differently.
Oh, excellent. Because I know there's a lot of people, my gums are receding. They're not thinking anything of it. I'll just brush harder. Right?
Yeah, don't do that.
Yeah, I know. That's what they tell you to do. But I mean, we all know, don't do that. Or I'll floss more, those kind of things. But that really does lead to other parts of your body being affected, does it not?
Yeah. So when disease is manifesting, it's not the signs and symptoms aren't the first thing that happens. The disease manifests first. And then later down the road, you see the reasons, you see the bleeding, you see the inflammation, you see the pocket depth. But the disease and the pathogens that cause that disease and that destruction and the inflammatory response as a result of that have been there and have been seeding for a significant amount of time. So I use salivary tests, which will identify those pathogens and before the presence of them is known by symptoms. And we can identify and we can change the biome within your mouth, which changes the biome within your body. So your saliva is made from your blood, and we swallow a liter of saliva a day. So it's all part of this system, and it's all circulating and it's all interacting. So the earlier you identify, the longer we can maintain your health and not get you into a disease state, not be a reactive disease state, but be in a preventative measure prior to having to deal with those symptoms, because we identified what could occur and what is destructive in your body early on.
It's a lot different than what you all think as a dentist. That, oh, my tooth broke.
Yeah, right. And I can fix that. Yeah, that's cool. We can fix that, because dentistry will always occur.
Right.
Once your tooth has been touched by any doctor or any dentist, it will always be touched again. It's just progression of the tooth. Once it's been broken into, forever need changes, because nothing lasts. The original tooth didn't last. How could you possibly think that a man-made thing would improve over the natural? It won't. So I don't focus on that. I focus on how can I improve and maintain what your current states are, like what your current disease is, what your current health is, and then go from there. So I think of your routine dental visits as maintenance for your cardiovascular system, as maintenance for your cognitive sustainability, as aspects of trying to not develop tumors and cancers. It's not just, I guess, annoyance that you have to come. It's part of your whole body regime.
It's true. I mean, we were just talking about preventive health. People go to doctor, hopefully on a regular basis to make sure everything's good. Why are you not going to a dentist to have your teeth cleaned on a regular basis?
Right. And it's not, a lot of people are like, they don't really like the dentist because it doesn't hurt, but you told me I need to fix it. Okay, I get it. But like what we see is that it will hurt. And it will cost more and it'll hurt more. And then you'll really be upset. And then the fix will be larger. But what about health maintenance instead of disease reaction? So it's much cheaper. It's much easier on the body. It's much better to never get into a disease state. It's a lot like if you have $100 and you lose 20%, you have 80. But if you gain 20% back, you're not at 100. So anytime disease state sits in, the risk factors that you have lost are never regained. So I like to try to maintain people at whatever current state they are and then improve from there.
So it seems like you're trying to get ahead of some of these things that people may think, okay, I'm having a problem with my liver or something like that. And they don't realize it could be something in their mouth that's causing that.
Right. We are trying to get ahead. Disease in America currently is your doctor says you're fine until you're not. But there's a long route from good to bad. And we want to preserve that and not go over that cliff of, okay, now you're sick. The pathogens that are in our mouth are in our body. They contribute to the gut health. They contribute to the blood-brain barrier. So once in the body, you have what we call like dyssymbiosis, or you're no longer balanced. That is going to continue cascading through all of your systems, and it's going to have manifestations everywhere because all of our systems interlink and they all function off of one another. So it's just like sleep and what we eat. And sleep is incredibly important, and it impacts your cardiovascular health, or having sleep apnea impacts your cardiovascular health in incredible ways, which also impacts your hippocampus and pituitary gland, and that rolls into your insulin control and glycemic control. So to think that we can just isolate one aspect of the body and think that it's only affecting me here it's a misnomer.
It sounds pretty like people should be going to the dentist on a regular basis and getting everything
prevention.
Yes,
you have to think of the dentist now. You need to reframe it as cardiovascular prevention. You need to reframe it as maintenance of mental acuity. You need to reframe it as glycemic control. It has so many implications, and the reason I say like cardiovascular. People who have periodontal disease are 2 to 3 times more likely to have a cardiovascular event, meaning a stroke. Like 2 to 3 times is a significant amount of reduction of just going to your dentist.
Wow.
If I could reduce a risk factor by 2 to 3 times, I would be interested. Well, even more so in this I always look this fact back up because I think it's incredible. But people with periodontal disease and diabetes have a 400 to 700 times increased risk and mortality.
Wow.
That's staggering.
That is. So if you are in one of those two categories, you better go see Erica.
People with periodontal disease who have breast cancer, 14%.
Mhm.
And again, like 2 to 3 times colorectal cancer. Like the pathogens that are in our body are in our bloodstream. And when they're in your bloodstream, they're incredibly detrimental. And they're very capable.
Wow. It's pretty mind-blowing.
So I test for them. I want to identify them, and I want to start trying to clean your body out to lower your systemic inflammation and lower your risk.
Oh, good. And I think it can help a lot of people for a lot of different ailments, I'm sure, right?
Yeah. When you start thinking about just lowering, I mean, it's a basic fact of inflammation causes disease. So that's a lower inflammation. Let's just break it right down to inflammation.
Wow. Yeah, I got a lot of that going. So.
We all do. We all do. There's a lot of sources of inflammation in our lifestyle. So combating that is, I think, the number one manifestation of health.
That sounds fantastic. I got to switch gears a little bit on you.
Sure.
What prompted you to open up your own practice versus, but many trends do. You get done with dental school, you at work.
Yeah, it was the fact that, we go back to my dad again. It's just, I just always knew that I wanted to be my own owner and be like him and have that freedom. I guess with medicine and however any practitioner practices, it's very personal, and our philosophies are very personal, and they're built on our history, they're built on our education, they're built on our interests. And so I think it's very difficult for any practitioner across any health spectrum to not be able to put their own philosophy and their own beliefs in practice. My father, being a dentist, had a lot of dentist friends, and they were all happy. They were all happy. They're all sitting back and discussing, and they were all very satisfied, happy people. And I want to be in retirement, very satisfied and happy with what I accomplished.
See, dang, Dad knows best.
That's Mom does too, but Mom isn't the precursor of this choice.
Wow. So today's episode should be Dad Knows Best, I think.
Dad has done really well for leading me.
Excellent. That's always phenomenal to hear. So now we know who your kind of role model and mentor, definitely a mentor.
Sure.
Absolutely. Kind of guiding you this way.
It's interesting because we do dentistry very differently, which is what he's always telling me. So he comes to conferences with me so that we can continue our discussions.
Nice.
But his philosophy of care first, that's what it is.
That's it. Yeah. And I know from my point of view, and I've talked to so many people about their dentists, it's you don't go to a dentist that you hate.
No. And your philosophy has to align.
Exactly.
And so anybody who's sitting there going I don't really like where I go, but I just go because that's where I go.
Right.
I don't think that they're ever going to be comfortable in that treatment. I don't think they're ever going to be comfortable with the decisions that they and the dentist or whatever provider made, because you need to be personally aligned philosophically. Right. You need to believe in this person's intent for you. You need to believe this person's intent for you is good. And if you're not there, then you guys are kind of always fighting against one another, and you should probably just find someone else so that both of the relationships feel more rewarding.
Oh, absolutely. Yeah, where I go, I know the guy. I mean, I know him. Not just he's my dentist. I'm I know his family, everything.
When you're giving your body to someone else, you have to believe in that person.
Right.
Otherwise, the care is almost futile because you're kind of already geared up to be a little I'm not sure, is this right for me? So, I would interview whomever is going to give you care and make sure that you feel good with that person.
Oh, absolutely. So I got to ask you one of our great loaded questions that we always ask.
A loaded question is great.
It's it's usually, what is one of those favorite hidden spots? It might be hidden, it might not, that you and maybe your family like to.
I have great memories and experiences at the chip. I think the majority of our population does, but I think it's kind of fun because I've actually had memories at the chip with my parents. before I met my husband. I have memories of line dancing with my husband at the Chip. And then I have a very questionable memory of riding the mechanical bull with my daughter at the Chip because she was so young but wanted to do it. So we both went on. And tandem bull riding is much more difficult than one would imagine.
Yes. Well, that's amazing. The Chip. All right.
Chip. That's why it's still there.
It's so true. There's so many great spots up here. And to choose one like that, that is tough. So I applaud you on that one.
It's the generational memories.
Yes, and that's great. I think, people who've lived here for a long time have memories of certain places here. It could be a restaurant, it could be a retail, it could be an art gallery, it could be a museum, it could be a park. They have some kind of connection with that.
But I think that what's so special about here is that there are those kind of like generational memories.
Right.
So the things here have been here a long time. They're well established. The community is well established. And so you get to keep going back to a place, a favorite memory with different people. And that memory gets to evolve and change.
And you get to share it.
Yeah.
Yes.
Like it's not somewhere that's like there once, it was hot, it was great, and it's gone.
Right. Yeah. Now people come in from out of town. I'm sure you know other people. What do you want to do? I know where we're going to go.
Yeah, this is going to be your spot whenever you come back.
That's it. Get them hooked on bull riding.
And a bull riding.
Is there anything you'd like to let everyone else know that we haven't covered already?
I just appreciate the embrace that the community's given me and the interest that the community has given me. And I just want to say thanks.
Great. And how can listeners and viewers get a hold of you?
Oh, we're easy. DMD Dental and Wellness. Instagram is DMD Dental. You can book online. You can call our office. We're readily available. Oh, also, I guess I should say this. I function more as a concierge type dentist. So I do not have multiple people in the office at the same time. So I will give you all my attention. We're not rushed. We want to make sure we understand your needs and satisfy them.
Nice. And we're going to actually have all of Erica's information down below. So reach out to her if you think, hey, something's just not right in my body. Maybe it could be started the cause of your mouth. You don't know. So reach out and find out.
Thank you.
I just want to say thank you so much for being our guest and talking to us about, oh my God, it's going to be a lot to comprehend. You're going to go home and everyone's going to be like, I'm not going to swallow anymore.
I'm not swallowing. No more saliva. From now on.
Exactly. I don't want to get sick. No, swallow.
Yeah.
Swallow your own saliva.
Swallowing.
It's all good. But yeah, if you have that concern, please reach out to Erica. She's an expert in this world. I know I've seen her facility. And if you go, you're going to love it. Take a look at the picture of that X-ray. I don't even. Yeah, I was like, everyone's going, look how cool that is. It's so crystal clear of the inside of your head. Not like your brains and everything, but muscles and everything. It was really fascinating. I'm glad you showed it to us because it was a highlight. Everyone kept taking pictures of it.
Yeah, it's neat.
Folks, please make sure you like and subscribe to our channel. And if you have any comments for Erica or myself, please make sure you leave them below. Or if you have ideas for future episodes or maybe a great guest, let us know, or a great topic even. But like and subscribe, reach out to Erica if you have any other questions. Just want to say thank you again for being on the show.
Thank you for having me.
I'm Steve Fell with Erica, and we wish you best in your business.
Thanks for joining us on the Community Brew Podcast, Commerce and Conversations. If you enjoyed this episode, be sure to like, subscribe, and share it with your friends, fellow business owners, and community champions. Don't forget to check out our other episodes for more tips, stories, and strategies to help your business grow, all served with a local twist. Until next time, stay connected, stay inspired, and keep brewing success in the desert foothills. The Carefree Cave Creek Chamber of Commerce wishes you much success.